C103.
And we're off to the Health Hub Times Square in Ballincollig. We're joined by Anneliese Dressel. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
And you're very welcome. Let's get straight into questions. Sean was on to us earlier to say, could you ask Anneliese, please, is there anything I could take that could help me to prevent what Sean calls the stomach flu, the norovirus? Despite taking a good multivitamin and practicing really good hand hygiene, I got it at least 2 episodes last year, and I seem to be getting 2 episodes every year. Anything else I can be doing to avoid it?
So I suppose ultimately really it's down to stomach health, Patricia. I don't know, is Sean on a proton pump inhibitor for acid reflux? So we generally have very nice, strong acid in our stomachs, and that would kill it. Actually, sorry, this is the virus now as opposed to stomach.
It's the virus.
Yeah, it's the virus.
Yeah.
Okay, so I think it's still really about having a healthy gut. So I definitely would take some type of a probiotic because there's lots of connections between the immune system and the gut to begin with anyway, and that goes for every kind of virus. And then I would work as I would with any viral infection. So I would take things like vitamin D, zinc, selenium, vitamin C, like the elderberry complex that I talk about all the time is a great one, and also the Nature's Plus Immune Boost is a very good one. And then there is something that maybe you could try if you do feel that you're sickening. You could maybe start to increase the probiotics and take something like grapefruit seed extract, which is a great kind of a natural antibacterial, antiviral, antifungal, anti-everything, and it can help with stomach issues as well when you're feeling, when you're sick. So that could be something you have in your medicine cupboard as a starting factor when you feel you're starting to get it. But really, again, it's all about that prevention. There used to be a great supplement, Patricia, and we can't get it anymore. In Ireland, it was called Nutri-Advanced. It was called Virese, V-I-R-E-S-E, and it was a great one for people who used to keep getting recurrent viral infections, and it would work great for the stomach too. So it was made with something called monolaurin, M-O-N-O-L-A-U-R-I-N. So if you go online and see, can you find that, you might be able to order that from overseas, and that's another great preventative for anything antiviral.
Okay, thank you for that. All right, this is from, there's no name on this. Hi, Patricia. My husband has short-term memory loss. Could you ask Anneliese, is it okay for him to take ginkgo biloba while on Lipitor and a blood pressure tablet also? Is there any alternative, like a herbal alternative, to lower blood pressure?
So there's a couple of things there. The first thing is short-term memory loss. So I have noticed, Patricia, with some people on the statins that can be one of the side effects, the Lipitor. Lipitor blocks a path in the liver that makes cholesterol, but it also makes something called coenzyme Q10, which is an essential component for our energy pathways, for our whole bodies. And that's why people get muscle pain sometimes, or maybe their muscles even would kind of start wasting a little bit. And in your brain needs a lot of coenzyme Q10 because it's burning a lot of energy. So I would suggest that the first thing to do would be to take a supplement called coenzyme Q10, at least 100 to 150 milligrams, and see does that resolve the memory issues, because it could be a side effect of that. If not, it could be stress related, or it might be the onset of cognitive decline. So if that's the case, it would be important to figure out what was causing it, Patricia, because there's different things for everything. So ginkgo biloba is a great one for cognitive decline, great for supporting memory in the long term. But it does thin the blood. It's fine with blood pressure tablet. It's fine with the statin cholesterol drug, but it wouldn't be fine if you were on a blood thinning drug. It's not fine with that because it also thins the blood. So just be wary of that. But I think in this case, it's important to try and figure out what's driving that short-term memory loss and work at that level.
Okay, Maura wants to know if it is necessary or even a good idea to take a calcium tablet daily if you've had a very positive result on a recent bone density test. I'm in my mid-60s, thanking you in anticipation.
Okay, so I'm not sure if it's a positive result that you've got good, healthy, dense bones, or if it's a positive result for osteopenia or osteoporosis. So if you don't have osteopenia or osteoporosis, I am not a big fan of taking calcium on a daily basis. I think we get plenty in our diets, especially if you've got dairy in your diet, which we tend to have a few times a day with milk and yogurts and cheese, etc. Calcium, too much calcium actually, Patricia, can harden the artery, the cholesterol that can build up in the arteries. So it can lead to increased plaque formation. So I certainly don't like anyone taking a high dose of calcium, especially if they might have high cholesterol. Now, if you do have osteopenia or osteoporosis, you may need to take something to support your bones. So I would much rather see somebody take an all-around supplement that has a lower dose of calcium, but that has vitamin D in there, which is very important for absorption of calcium. Vitamin K, which protects the heart arteries. It stops the plaque hardening in the arteries, so that kind of overcompensates for excess calcium. And then it might have other things in there like vitamin C. And the good calcium to take as well is a very easily absorbed a form of calcium. A lot of the time now, the newer bone supplements, it's coming from algae, which would be a very easily absorbed and utilised form of calcium. So in terms of the two supplements that we love here for bones, we either like the Nature's Plus Bone Support, or we like the One Nutrition Bone Factors. Both of those are excellent. The Bone Factors is a newer one, so and it's lovely ingredients, Patricia, but we haven't had loads of feedback on it yet because it's only out recently. But the Bone Support from Nature's Plus we've been selling for years, and for some people it has even helped slightly reverse their osteopenia and osteoporosis, so it can work very, very well.
Okay, could you ask Anneliese, please, what I could take to prevent bouts of diverticulitis? Now, I avoid seeds and fibre, etc., but would there be any supplements I could take that might prevent future outbreaks?
There is, Patricia, and I think it's going to be very different for everyone. And I know that some doctors say avoid seeds, and some doctors say no, it doesn't make any difference. And I think having a soluble fibre in your diet is very important. So the difference between the insoluble and the soluble, I always think of a celery stick. You know, when you pull the stringy bits off celery, and it's so hard even to chew it, that's insoluble fibre. So that can actually... sometimes for some people it can actually make them more constipated because it's very hard to digest, and so it's very hard to push through sometimes. But the soluble fibre is kind of more the gel, like the juice of the celery, and things like psyllium husk, oat bran. These would all have loads of soluble fibre, and they help form a kind of a gel matrix within the stool, make it very soft, very gentle, very easy to pass, and they can hold it all together as well. So I think the most important thing really to prevent diverticulitis is to have a daily bowel movement, a healthy bowel movement, and to support the good bacteria in your gut. So I would definitely consider taking a good probiotic on a regular basis, unless you're taking things like kefir, raw yogurt or kombucha, or those fermented foods that have naturally those probiotics in there. And that's the best way to go about it, Patricia.
Okay, any help for poor Phil suffering very badly with mouth ulcers on the tongue, and they can be agony?
Oh, God, I can imagine. I get them the odd time myself. Actually, to be honest, Patricia, the most common thing is being allergic to sodium lauryl sulfate in toothpaste. And now that I think about it, I haven't had one for years. So sometimes that is just the problem. A lot of the toothpaste you'd buy in the supermarket, even the sensitive ones, they have the foaming agent in there called sodium lauryl sulfate, and a lot of people react to that. So that would be the first thing I would switch to, a natural toothpaste. And it takes a bit of getting used to as well, Patricia, because they don't foam up as much, so you don't get that same kind of clean feel. So I'd recommend an electric toothbrush to improve your brushing. So there's lots of natural toothpastes. You'll get one in a health store, and you need to make sure to ask for no sodium lauryl sulfate in it. And then I think probably taking a vitamin C and zinc is very good, because that's a big thing in terms of skin health, which is the mouth. So take a vitamin C and zinc supplement every single day. It's very easy to get them together. You'll get them both in any health shop, and that should sort the problem out. Oh, sorry, the last thing I should mention as well then is colloidal silver is a great one for healing and preventing them from getting infected. So you can buy that in a little spray, and you can spray it onto the ulcers if you do get one, and it'll speed up the healing time.
Okay, would you have any view on this? Somebody said, would you ask Anneliese, is too much sparkling water bad for you? I drink it a lot, says a texter.
Yeah, I think it probably is in the long run, Patricia, because it is there is acid in it, you know, it's carbonic acid, so I don't think it'd be great for the teeth. Don't know about the stomach. I suppose it might make you a little bit burpy, but that's not really going to do you any harm. But definitely, I think for the teeth, it wouldn't be good for the teeth because the bubbles in it tend to be. Now it depends again. I suppose if it's natural spring water, it mightn't be as bad, but I would still say it's slightly acidic. So maybe just rinse your mouth out with some ordinary water afterwards, or brush your teeth afterwards.
Okay. And hi, Anneliese. Would Anneliese know if very, very bad anxiety, is that part of menopause?
Yes is one answer. No is the other, I suppose, Patricia. Definitely, I would see a huge amount of anxiety in women who are perimenopausal and menopausal. So it is very common. And I think I think our lives can be very, very stressful as well. So that can also be another factor. And then because they're all made from the same building blocks, the stress hormones and the sex hormones, when you become menopausal, anxiety worsens for that reason. So a lot of my favourite actually natural menopause support here, they actually have got herbs in there that support for stress. Nothing to do with sex hormones, but if you're supporting for people with busy, stressful lives, it will help with hormone balance in the long run. So what I would suggest is, if you don't want to do HRT, do a natural HRT. And the one that we love here, and it works the best with that stress support in there, is called Nutri-Advanced Perimenopause Support. And then I would take something on a daily basis that will help in the moment to kind of calm down and relieve stress until that really kicks in. So that would be either something like L-theanine and lemon balm. Viridian do a great one. Or you could also use cannabis oil, which is very, very quick as well. And they would work within 10-15 minutes to reduce those anxiety, panicky feelings. And you can take it pretty much 4 or 5 times a day without any negative ill effects. So that could be a good crutch in the meantime until the other stuff kicks in.
Okay, we'll leave it there, Anneliese, and have a great week, and we'll talk to you again next week.
Thanks, Patricia.
Thanks a million. That is Anneliese Dressel of the Health Hub, Times Square in Ballincollig. And this afternoon, Anneliese will put up all of the items that she mentioned. She'll put it up on her website, which is healthhubstore.com.